Good afternoon. My name is Zsófia Vincze, and I would like to present my PhD topic, which is the evaluation and comparison of different complete denture processing technologies. I'm a dentist from the Department of General Dental Preclinical Practice. My supervisor is Kristina Márton, and my scientific methodology supervisor is Kata Kelemen. My vision is to resocialize edentulous patients into the community by providing them a durable and feasible complete denture. I have two ongoing projects. The first one is investigating the mechanical properties of the denture-based resins, which will be a systematic review and network meta-analysis. The prevalence of edentulism is very high, especially in the older generation, and this leads to functional limitations and can cause social isolations. According to the United Nations, by the end of 2050, there will be twice or even 3 times more aged persons than nowadays. That is why we have to be prepared and provide them a solution for this edentulism. One of the most common treatment is the complete denture, which is traditionally made by the dental technician, but it takes a longer time. But if we use the newer CAD/CAM technology, the subtractive milling or additive 3D printing, we are able to reduce the cost and the number of clinical appointments needed. When the patients are using the complete dentures, during mastication they are repeatedly undergo flexing, and this can cause a fracture or crack. And when the surface of the denture is rough, then the bacteria and candida adhesion will be also higher, and that can lead to oral infections. So our aim is to investigate the mechanical properties of different types of denture-based resins. Here you can see our clinical question. Is there a difference in mechanical properties of CAD/CAM produced complete dentures and conventional complete dentures? Our hypothesis is that there is no difference between the conventional milled and 3D printed denture in terms of flexural strength, surface roughness, and elastic modulus. Our clinical implication is to find an alternative method to produce complete dentures quicker and cheaper without the decrease of quality. I conducted my systematic search on the 25th of November in 4 databases. Here on the slide you can see our search key. In the first domain we listed the material, what we would like to investigate, the PMMA denture-based resin. In the second domain, we listed the processing technologies, what we would like to investigate, and in the last domain, we listed the mechanical properties, what we would like to investigate. One of the strengths of our key articles is that in all of them, the specimens were made according to an ISO standard. And in one of our key articles, the effect of thermocycling was also investigated, which I think is very important because with the aging of the material, these mechanical properties can also change. In the other 2 key articles, they did not investigate this thermocycling, which is a limitation of those studies. Also, in none of our key articles, they did not investigate the different 3D printing building angles, which can also affect, for example, the surface roughness of the material. Here you can see our flowchart of selection. After the systematic search, we had a little bit more than 17,000 articles. After the duplicate removal, we had around 12,000 studies. And after the title abstract selection, we have around 500 articles. So after the topic was found feasible, we could do the Prospero registration on the 24th of November, and then we could do the duplicate removal and start on with the title abstract selection on the 26th of November, which I could finish, and right now we are working on the full text selection. My plan is to finish with the full text selection in December and with the data extraction in January. Now I would like to introduce my second topic, which is the evaluation of microbial adhesion of traditional PMMA resins and CAD/CAM based dentures, which will be also a systematic review and meta-analysis. just like I mentioned in my first project, edentulous is very high, especially among older people, which leads to functional limitations. And one of the most common treatment options is the complete denture, which we can produce using the conventional technique or the newer CAD/CAM technology, the subtractive milling or the additive 3D printing. Even in a healthy person's mouth, there are a lot of bacteria and candida living, but in case of a denture wearer, these bacteria and candida can connect to the denture base and can cause denture stomatitis, which is the inflammation and erythema of the oral mucosal areas, and it is quite common among the denture wearers. This can reduce their quality of life because they can feel pain during eating, swallowing, or speaking. And it is especially dangerous in case of immunodeficiency or immunosuppression because this bacteria can spread to other organs, for example to the lung, and can cause an inflammation there. So our aim is to investigate the microbial adhesion of CAD/CAM produced complete dentures and conventional PMMA dentures. Our clinical question: is there a difference in prevalence of microbial adhesion of CAD/CAM produced complete dentures and conventional PMMA dentures? And our null hypothesis is that there is no difference between the conventional and the CAD/CAM produced denture bases in terms of microbial adhesion. And the clinical implication is that we would like to reduce the incidence of denture stomatitis. Here you can see our preliminary research key. With that, we found around 4,000 articles in 4 databases. And I collected my key articles in this table. They match our PICO. All of these articles investigated the Candida albicans adhesion, and some of them also investigated different bacterial adhesion as well. So right now, the progress of my second project is that it was found feasible, and I would like to register it in Prospero in January. So right now we are working on these 2 projects. I would like to submit them this summer. The first one about the mechanical properties in June, and my second project about the microbial adhesion in August. And I would like to close my presentation with a quote by Edward Teller, that the science of today is the technology of tomorrow. Thank you.
Thank you. Congratulations for your project. I have one question, that maybe the second project is an in vitro study, isn't
Yes.
it? I would put into the title because it could be a clinical study as well, and it would be more clear.
Congratulations for the presentation. And I would like to ask a question. How did they measure the surface roughness in these studies?
They used the scanning electron microscopy, and on that image they could see the deepest valleys and highest points, and they could count an average surface roughness in these studies.
I'd like to ask about the cost effectiveness of this manufacturing technique that you showed us. Do you know anything about the costs regarding to the manufacturing types you are investigating?
Yes, so as I mentioned, the CAD/CAM technology is cheaper. I read an article which was made in Switzerland that altogether the overall cost was around 2/3 of the normal cost with the digital workflow.
Okay, thank you very much for your answer.
Congratulations for the nice presentation. Maybe the main problem with CAD/CAM produced complete denture is the lack of retention because of lack of border seal. Will retention measured as an outcome or patient satisfaction?
Sorry, could you repeat?
The main problem with CAD/CAM produced complete denture, maybe the lack of retention because there is no border seal. So this will measured as an outcome or patient satisfaction regarding retention?
Yes, thank you for your question and the suggestion. In the first project, we would like to investigate only the mechanical properties, but maybe we should consider adding the retention and patient satisfaction as well, or maybe in a different project. But for sure, we should check that as well.
So congratulations, it was a very nice presentation, and I have only one question. Do you know any data about approximately how many patients are edentulous in Hungary?
Thank you for your question. Right now, I cannot give you exact numbers, but there was a study around 2010 when they checked the prevalence of edentulism, and among the older generations, so I think about the year of 65, it was around 15% of the population.